From Valley Chiropractic. Sorry, I'm just getting my ears on here. Last minute, trying to get on here and give you a tip for this week. So today I want to talk about finding the right chiropractor for you. There are many, many different types of chiropractors. So a lot of people don't realize that. They don't realize that there are so many different techniques that chiropractors use. In fact, I think there's over about 100 different chiropractic techniques. So a lot of times if you've been to one chiropractor, it can look completely different going to another chiropractor. It's actually fairly unique in our profession. Almost any other profession, there is a lot of continuity in what you would see in an office and what to expect. There are different types of dentists, massage therapists, acupuncturists that specialize in different techniques. So there is some difference with other professions, but with chiropractic, it can actually be very broad. There are some chiropractors who use instruments to adjust. There's some chiropractors that use their hands to adjust. The equipment and the tables can look different in different chiropractic offices. And even assessments can look slightly different in different chiropractic offices. So finding the right chiropractor for you can sometimes take some time and can take meeting some different chiropractors to find the right fit. In our office, well, in all offices and chiropractic offices, we're required to do an examination before you receive an adjustment. And those examinations can differ slightly from chiropractic office to office. Most of them will include some kind of physical exam, a thorough case history, a report of what they find on you, and then an adjustment. Sometimes that can be done in the same day. Sometimes it will be on a different day or a different visit. Some offices will take x-rays if they find that it's beneficial for your care, for your safety, and for your treatment. Some offices do not take x-rays in their office for various reasons. Maybe they think that there might be a little less risk because they use less force, or anyway, different reasons. We do have x-rays on in our office. We find that they're very beneficial for patients so that we can determine not only any misalignments in your spine and see things and see curvature in your spine, also to see if you have any abnormalities in your spine or anything that would be risky to getting an adjustment. So when it's applicable, we will usually take x-rays on patients for their safety and for having their best results possible. One thing that we do in our office that helps people to decide if we are the right fit for them is we offer free consultations. So we have people come in and we have them tell us what they're looking for, what kind of results they're expecting from a chiropractor. We tell them how we work, what expectations we have as a chiropractor for us and with the patient. And we see if we're the right fit, and we see if maybe it even is a chiropractic case that we should undertake. So we will be open with the patient and tell them what to expect and what we expect from them and go from there. I always encourage people to meet with other offices. Go in and talk with a few different chiropractors and see if the space fits with them, if they feel congruent with their philosophies and ideas of chiropractic. There are, like I said, a lot of different techniques. Even just witnessing how someone adjusts might make you feel more comfortable with that office and with that technique. There are people who do different focuses on their demographics and who they take care of. So there are chiropractors who focus on like musculoskeletal complaints, back pain, neck pain, things like injuries, auto injuries, workers' injury, if you're injured on the job. They really specialize in taking care of getting people back from injury. There are people who specialize in sports. So they've done more training and experience in taking care of athletes. And then there are people who are really, really proficient and great at taking and reading radiology. So some chiropractors will actually utilize them to have a second look at their films. And then there's chiropractors like myself who focus on a family practice. I focus on pregnancy, taking care of kids and babies, and I've taken hundreds of extra hours of coursework in that demographic. So I know the unique situations that we may be addressing in that arena, and so that we can take care of them safely, efficiently, and effectively. Chiropractic specialties aren't necessarily I wouldn't say promoted or put out there in the public, because it isn't like medicine where we have pediatricians and then foot surgeons and people who work on your shoulder, or cardiologists or gastroenterologists. Chiropractors can have more of a focus, but as a profession, we're only actually put out there as chiropractors. So it's sometimes hard to figure out what kind of focus or training that person has. So that's one thing you want to ask them in their consultation, is what their training is in, like, say, pediatrics, or what their experience is, or in taking care of athletes, or themselves as athletes and the care they've received. So there are a lot of different options with chiropractors, and a lot of people don't know that there's a difference. They think if they've been to one chiropractor, that all the rest are going to be the same, and how they not only assess somebody, but how they adjust them and how they work with them in regaining their health and their vitality. So I hope that this gives you a little bit more information on the differences that you can see within chiropractic offices, and I encourage you all to go out and make sure that you are meeting with chiropractors and asking them questions and seeing if they fit with you and their philosophy of health is the same as yours, and what you are wanting, that they are able to answer your questions and you feel comfortable with the care that you receive. And if you don't, then you find another chiropractor or interview someone else to see if they are the right fit for you. We've had plenty of people that fit great with our office, and we take great care of them, and we work really well as a team. But there have been people that our philosophy or their goals haven't quite matched, and we have either sent them on to someone else that we think is a better fit, or they've just found that person on their own as well. So finding the right person for you is very, very important for your health, your wellness, and for continuing on and having a healthy lifestyle. I have had many, many different chiropractors throughout my life. A lot of them I changed just because I had moved locations and moved to a different town. So we really want you to find the person that fits for you. We want to find the right person for your goals, and to find someone who you're comfortable with, because we think the most important thing for you is to have a chiropractor that you are confident in, and one who is treating you like you want to be treated. So we'd be happy to do a consultation. We do free consultations at all times in our office. If you have any questions, I told you before, I work a lot with pregnancy, with babies, with children, with adolescents and teens, and with moms who are trying to get pregnant. That's kind of my demographic. I do all ages. I have people who are elderly as well, and adults who are empty nesters. So I don't just limit to that, but that is what my focus is. And my husband is doing a lot of work with athletes. He is an athlete himself, and he loves family practice. So he usually does like the older kids and families. And he also is really, really great at helping people get better who've been in accidents or injuries. So that is a great resource for you as well. So come on in. We'd be happy to chat with you. We'd be happy to give you a free consultation, show you around our office, and show you what we do. If you have any questions, let us know. We'd be happy to answer them. You can leave a comment in the comment box. If anybody's watching right now and has any comments, feel free to pop one in, and I'd be happy to answer it. Otherwise, I will get back to you soon, and you guys have a wonderful, wonderful day, and happy April, and we will see you soon. Bye-bye.